Thank you, Senator Hoeven. Just to continue on with the recruitment and retention issues, what's the current turnover rate with physicians within IHS right now?
We are looking at between an 11 and 13% turnover rate currently, agency-wide.
Agency-wide, and so it was a difficult exchange with you and Senator Tester there in terms of the impact that this budget will have on your ability to recruit and retain. And I think we all recognize that this has got to be a priority. You've just given Senator Hoeven a priority, a commitment that you will retain this as a priority. Do you have the flexibility within IHS to offer competitive salaries? Is that part of our issue?
We've got a lot of tools in our tool belt, our abilities to provide recruitment, retention, incentives. We use the federal
Is salary
pay
a
scale.
primary barrier?
We have been able to attract some of the very best of the best. Some of my colleagues in the IHS are at the top of their profession, top of their game. I think it's not so much an inability to recruit the best of the best, it's recruiting enough of the best of the best.
Well, and it's also retention, because when you've got turnover like this, it's one thing to get folks out there, it's another thing to keep them. How big, I know in Alaska, housing is a big consideration. You go out to many of our areas and there is no housing available. You have your physicians that are effectively living in the hospitals, living in the clinics. How big of an issue is housing, for instance, in the Great Plains areas that I was speaking about earlier, in an effort to recruit, retain your professionals?
Yes, ma'am. I had the opportunity last year to live in Rosebud myself for 5 months and to really assess the situation. And housing is definitely a concern in Rosebud, Pine Ridge, other rural and remote locations.
What are you doing to address that?
I know that we've been able to, with resources provided, start to look at some innovative designs and building some hotel-type facilities, specifically in Pine Ridge and Rosebud. We have some 21-unit construction projects that are underway, and I'd like to ask if Mr. Hartz, is our facility construction expert, can weigh in more.
Please.
Thank you, Admiral Weahkee, and thank you, Senator Murkowski. Good to see you again. What you've identified is definitely a need across all of Indian country, and in this past year, we have provided resources to construct the apartment-type complexes for permanent, single-family, two-bedroom units as well as for itinerant people coming into Pine Ridge, Rosebud, Chinle, Crown Point on the Navajo Reservation, also addressing some issues in the Hopi Reservation. And with the resources that you folks provided to us in FY17, we're going to distribute, I was going to say we might have even already distributed, but money will be distributed to the three primary areas that have the greatest need for housing, and that's Alaska, Great Plains, and Navajo. So we'll be providing those resources from 17 for that purpose. And, it relates back to build it and they will come. Whether it's in healthcare facility construction, whether it's having the ability to house people in quarters that are not 60 years old, it makes a difference. And even the senator has left, but even the program in the country at the University of North Dakota that has the NMed program that has kicked out more physicians, Indian physicians, than any other institution in this country. And we have many of them across the infrastructure of Indian healthcare delivery, tribal and federal. And it's something that we are addressing. We thank you for the partnership of assisting us in getting those quarters out there, and we will continue to do that in any way we can. We're even looking at the HUD program under Section 184, and whether there's ways we can develop private, tribal, federal partnerships to come up with a way to further supplement this need that exists across Indian country.
Well, and I think that's an important part of what we need to look to when we try to understand what's going on with recruitment and retention. If you're out in an area where there is no housing or where the housing is so substandard, there's a lot of competition for doctors all over the country.
Right.
And it's not just within IHS. We're still trying to get docs within the VA system. We're trying to get doctors, throughout. And so things like housing are important. But it takes me back to the budget that we're looking at. This budget request proposes an 18% cut to the facilities program. So whether we're talking about housing initiatives or recognizing that the facilities that are aiming to meet the needs of our Native peoples are roughly 4 times the age of their private sector counterparts. You've got a maintenance backlog that is also over $500 million. So I understand. I'm on the Appropriations Committee. I understand that we have an administration that is trying to rein in our spending. We need to do that. We need to be responsible to it. But we also have a trust responsibility to our Native people. And in order to meet that, we need to make appropriate investments. And those appropriate investments are being overlooked, I think, in this budget. I don't see that with this large backlog of construction and maintenance projects that we have, that we can continue to do the good work that I think you have outlined, Mr. Hartz. We're making some progress. How do we continue that progress when you've got an 18% cut in your facilities budget here? Anybody have an answer? Mr. Hartz?
Some people may say I've been around too long, but I've seen a lot. And as the budgets have gone up and the budgets have gone down, we've had to come up with ways to manage that within the confines of the resources we're provided, ever mindful of the priority to serve the American Indian Alaska Native to the highest level that we can. And, on the M&I account, you mentioned that. I mean, the need is in excess of $500 million, no question about it. And we have taken the appropriations that we've received and coupled that with Medicare, Medicaid, private insurance collections. We've got examples of areas taking 75% of project funds going in to some M&I work in the Portland area came from other than the M&I. So we continue to work to see how we can best partner with others, whether it's in sanitation facilities. We've done the same thing in delivering sanitation facilities. On the healthcare arena, it's pretty direct that's appropriations, unless, of course, we can get involved in the joint venture program, the small ambulatory program that you helped us out again this past year, and we appreciate that coming from the committee. We report approximately a year ago, we submitted the second facilities assessment report to the Congress. And that report indicates with the needs that were determined, not only existing authorities, but the new authorities that came with the law were incorporated in. And it's already been stated, I think, here at the hearing that existing piece was over $10 billion of need for healthcare facilities. The new piece, new authorities, is another 4 billion plus. So yeah, we've got these needs, and we have managed exceedingly well. We do not come back to the Congress for more money for any of our projects. We take a look at cost, scope, and schedule, and we work within that to make sure we deliver quality health care. And I can go to places in New Mexico, I can go to places in Alaska where you and I have been for dedications. I can go to Arizona. I can go to the places that we've, tried to keep up with the resources to deliver health care. And we have done a fantastic job, and it helps recruitment. It provides staffing at an 85% level, and the balance is covered by third-party collections.
Well, and Mr. Hartz, I'm going to interrupt because my time has expired, but your comment just there, that it has been helped by the third party payers, is exactly why we need to get this information from you about the impact the benefit then that accrues to IHS through Medicaid and Medicaid expansion. If decisions are going to be made to make reductions in this particular program, again, we need to understand what that's going to be doing to the delivery of the services that are expected.